will be seen here in the as the name branches of the arteries. I will go through this picture first. There is only one big artery that is coming here, that is the ophthalmic artery. It runs to the lateral aspect of the optic nerve and then crosses it superiorly while moving from the lateral to medial aspect, just as the nasociliary nerve was. But it is behind the nasociliary nerve. The nasociliary nerve will be running anterior and parallel to it right there. As it moves along, it will give the following branches. It will give the lacrimal artery. Lacrimal artery, however, it will go and give the zygomatic branches also. Zygomaticofacial, zygomaticotemporal. As it moves along, it will give the two arteries that were on the top of the eyeball, supraorbital, supratrochlear. As it moves to the lateral medial aspect, it will give the two branches to the ethmoidal foramina, anterior ethmoidal artery, posterior ethmoidal artery. They will have a similar course. The anterior will go to the anterior cranial fossa and then down to the nose also. And as it moves along, as it exits the eye below the trochlea, it does not have the same name. Here the artery name is dorsal nasal artery. We did the lacrimal artery, we did the supraorbital trochlear, we did the anterior posterior ethmoidal and the dorsal nasal artery, and then we are left with the arteries that are going to supply the orbit, that are going to supply the eyeball. There are two set of arteries that are going to supply the eyeball. First, you can see this artery. It enters the optic nerve. It is a very important nerve that is called the central artery of the retina. It becomes the part of the optic nerve and that it goes and spreads around in the retina itself. It supplies the retina. And the very important thing to remember is central retinal artery. It is end artery. It does not have any connection to the other arteries that are going to the eyeball. So if that occludes, you are done. Retina stops functioning. It goes under ischemia and the blindness follows. So this is the end artery, the central retinal artery. And then there are two arteries, two set of arteries that go and enter the eyeball and they have the name ciliary in them. The one that are approaching the eyeball from the posterior aspect that are known as the short ciliary arteries, the short posterior ciliary arteries, and the one that are going all the way across the eye and entering from the anterior aspect that will be known as long ciliary artery or anterior ciliary arteries. So these are all the arteries that are going to supply the eyeball and the structures around it in the orbit. There will be very similar structure for the veins. There will be in the openings that there will be short ciliary, long ciliary, but here their name is not, they don't match exactly to that. The veins that are coming from the eyeball are not named as short ciliary and long ciliary. They are named as vorticose veins. There are 5 to 6 vorticose veins that are exiting from the orbit from the different points. These are vorticose veins. Similarly, there will be veins coming back from the muscles and the foramina that we discussed the arteries with, and they are draining into two set of veins, a set of two veins on the upper aspect of the eyeball and on the lower aspect of the eyeball that are known as superior ophthalmic vein and inferior ophthalmic vein respectively. The superior ophthalmic vein and the inferior ophthalmic vein respectively. They are sometimes called superior orbital and inferior orbital veins also. Where do they go? Superior ophthalmic vein, the connections of the superior ophthalmic vein anteriorly, they do join with the facial vein, and posteriorly they do join with the cavernous sinus. That is how the connection of the danger area of the face is established to the cavernous sinus through the superior ophthalmic vein. The inferior ophthalmic vein, it is connected to the face through the infraorbital vein. It is connected directly to the connection infraorbital vein, directly with the connection of the facial vein, and it goes back and it may drain directly to the superior ophthalmic and consequently cavernous sinus, or it may go down to the pterygoid venous plexus. So these are all the veins that are present in the orbit and the drainage that is related to them.